Hi, and welcome back to my channel. My name is Charlotte, and I'm a breast cancer survivor. In a series of short videos, I'm going to share my breast cancer journey with you. If you missed any of the previous videos, I'll be sure to leave links in this one so that you can go back and view them. Now, before I get into the gist of this video today, let me just say that I pray that everyone is keeping safe and being respectful of each other amid the health crisis that we currently find ourselves in. This is not a political hoax, and this is not fake news. This is a very real crisis. Now, just to recap a little bit, in my last video, I shared that on March 29th, I had my double mastectomy surgery, and my surgery was successful. My cancer was gone before I had the surgery, and I later found out that I would not require radiation treatments. I was very happy to hear this news and would spend the next 2 months recovering from surgery, having Herceptin infusions, and going to follow-up appointments now with the plastic surgeon to prepare for my breast reconstruction. During my surgery, 2 tubes were placed in my chest to prevent fluid buildup. Now, when I came home, I had to monitor the level of fluids 3 times a day and record them so that the doctor would know how much fluid was still continuing to come out of my chest. During this time, I was unable to shower. I could not lift anything over 10 pounds, and I could not raise my arms above my head. Okay, now about a week after I had the drainage tubes removed, I had an incident where fluid began to build up in my chest, and it became difficult and painful for me to breathe. I contacted the plastic surgeon's office, and they immediately sent me to radiology to have the fluid drawn out. Now, the problem that occurred when I went to radiology was that during the ultrasound, the technician and the doctor did not know exactly where to put the needle, because while they were looking at the ultrasound, they couldn't determine where the fluid stopped and where the breast implant started, because you saw fluid on both sides, and they did not want to accidentally puncture the temporary breast implant. They struggled with this decision for a few minutes, and then eventually they went ahead and withdrew the excess fluid. Of course, a week later, the implant that was on the right side gradually started to get smaller because they did accidentally puncture it, and there was a slow leak. Now, since these were only temporary implants, there was no need for me to go into surgery and have this redone. So what I did, I just added a little filler in my bra to fill it out. Now, like I said earlier, I had decided to have a DIEP Flap Reconstructive Surgery. I chose this surgery over breast implants because after reading information and consulting with the plastic surgeon, this process I felt would afford me the most natural reconstruction results. Now, let me just share a few details about what the flap DIEP reconstructive surgery is. It's when the surgeon transfers tissue, fat, and blood cells from your abdomen area to your chest to recreate a more natural looking breast. By using my own tissue, it would heal better, and if I gained weight or lost weight, and as I age, the tissue would adjust with my body, unlike breast implants. And also, this is a 2-phase surgery. Now, after a few follow-up appointments with the plastic surgeon, we had set a date for the first part of the surgery to take place, and that was going to be Friday, August the 3rd. I went back to work on June 1st, and I worked for 60 days until my surgery date. Now, in the months leading up to my surgery, I would have to have another EKG to determine if my heart was strong enough for the next surgery. I needed to be examined and released by my primary care physician for the surgery. I continued to have Herceptin treatments, and I had to have numerous blood tests and follow-ups with the oncologist. Now, during one of my follow-up appointments with the oncologist, while he was reviewing my blood test results, he noticed that not only was my red blood count low, but now I was also anemic. At this point, he introduced iron supplements together with the vitamin D and low-dose aspirin therapy that I was already on, in the hope that this would raise my blood cell level as well as my iron. However, it did, but very, very slowly. Now, with my August surgery date approaching, I needed to give blood to be stored in the blood bank for my surgery. When I went in for this appointment to give blood, my blood count was so low that they could not withdraw any blood. My blood count, it needed to have been at 11, and currently it was at 9. So if they withdrew any blood, it would then be at 7, and it would be too low for me to have surgery. The plastic surgeon was informed about the situation by the blood bank, and both the surgeon's office and the blood bank told me not to worry because there would be blood available for my surgery if I needed it. Also, my iron levels were not improving fast enough, so 2 weeks prior to my surgery, I had to have 2 iron infusions. The plastic surgeon's office sent me pre-surgery instructions, documents that I needed to read, sign, and return to them, and a list of post-surgery garments that I would need to purchase and bring to the hospital to put on after my surgery. On Thursday, August 2nd, I had my pre-op meeting with the plastic surgeon. Now, at this appointment, he gave me more surgery details. He listened to, marked, and selected the blood vessels that he would be using for the transfer surgery. He selected 16 very strong blood vessels, and when he marked them, he told me to be very careful not to remove the marking when I took my shower that evening. The night before my surgery, I prayed and I told God if there was anything else wrong in my body to let them find it and fix it while I was on the table. On Friday morning, August 3rd, me, my mom, and my daughter met with the surgeon one last time before I went into surgery. He told them that this type of surgery usually lasts about 8 hours, but he said 8 to 10, give or take. He checked my blood vessels again, and again they sounded very strong. I went into surgery Friday at 7:30 a.m., and I came out of surgery on Saturday morning at 2:00 a.m. During my surgery, they ran into extreme complications, and my surgery ended up lasting about 18 hours. I'm going to end this segment right here, and I will continue it in my next video that I will be uploading very soon. Now, the one thing that I learned from this experience is to always have a support group put together for your family before you go into surgery, because you never know what will happen, and they may need somebody to talk to pray with, to bring them food, or just come and be supportive with them while they're waiting for you to come out of the operating room. If you enjoyed this video, please hit the like button and be sure to subscribe so that you'll know when the next video is uploaded. As always, thank you for watching and listening.